Let's go ahead and get started. Good morning, everyone. Thank you so much for joining us again for this next topic in our Casework Navigator Basics series. I'm Ann Meeker. I'm Deputy Director of the Pop Fox Foundation, former Director of Constituent Services on the House side. And today's topic, Intro to Data for Casework, has been so close to my heart for years. So I am so excited to dive in today. Now, when we talk about nudging casework into the 21st century, data is a key component to so many things that we talk about under that umbrella. It's key to understanding how casework teams are operating, for experimenting with new ways to do casework, or understanding in depth what your constituents are experiencing and your team's ability to help them, to communicating to your constituents the breadth and the scale of how your team solves constituent problems. But for me, at least, coming to casework without a quantitative background, my academic background is anthropology. Our approach was just let's hang out somewhere for a while and then like wave our hands and write down vibes. So like math was super scary to me. Actually diving in on some of that casework data felt super intimidating. It was really easy for me to second guess myself or dismiss what I felt like I was seeing in our casework numbers as just something that I wasn't really qualified for. But as we'll cover today, data doesn't have to be intimidating. A lot of what you're doing as a caseworker is already working with data to help you make decisions and prioritize your work, even if you probably haven't framed it that way yet. So coming at that work with some expert insight and strategy can help your team make the most of the work that you're already doing and help you make smart decisions about your operations going forward. Now, let me also say that how your team uses data is entirely up to your office. I do understand that some aspects of how you can collect data and what kinds of data you can collect using your CRM are going to change based on that CRM, whether you're using Indigov or IQ or Fireside, or one of the other ones. If you are using one of the other ones, can you please tell me how that is? I'm so curious about some of the smaller ones. So just to make sure that we're going to be responsive to your CRM specific questions, we did reach out to each of those three big CRMs in advance of today's call. And each of them was kind enough to share a little bit of information on how teams can use their analytics capacities. So I am throwing that in the chat right now. We did include each of those on today's event page. You'll see some resources, again, from Indigo, from IQ, and from Fireside. And we hope that those are helpful if you have questions specifically on your CRM. And all of them also include how to ask additional questions, where to contact your help center if there's something that's not covered in those. So to get us started, I am so delighted to welcome our speaker for today, Alexandra Mannerinx. Alexandra has a background in biology and data science, earning her PhD at the University of Cambridge, studying risk factors for animal-borne disease spillover to humans, before working in the healthcare industry, translating hospital data into actionable insights for decision makers, and launching her own data analysis and visualization portal in the meantime. She has consulted for everyone from top 5 accounting firms to tiny rural healthcare nonprofits and founded Marikinos to democratize data literacy and analysis, especially for organizations and industries that have not traditionally invested here. So you could see why when we met, I was immediately like, you have to talk to caseworkers. Please come talk to caseworkers about data and how we can really move casework forward. So Alexandra, welcome. Thank you for being here. We are so delighted to have you talk us through how data can play a role in operations like casework.
Thank you so much. I'm going to go ahead and share my slides here. So let me know when you can see those.
They're coming through.
Awesome. I am delighted to be here. It was such a pleasure to meet Anne and to learn so much more about the challenges that caseworkers are facing. And while I oftentimes work with nonprofits, we realized that the overlap here is almost 100%. The kinds of work that you guys are doing and the challenges that you face with data, you're not alone. I would like you to say that to start with. So I'm thrilled to be able to be here and geek out with you about how we can be both heart-centered and data-powered. And I want to clarify that we're not going to start with, here are the 6 measures you should talk about. Here are the 7 things that you must track in your CRM. Because in order for us to understand what measures that we really need to have, we need to be clear about what we are trying to achieve and how we are going to actually achieve that. So I'm going to start with a story here that is going to introduce a framework of decision-making with data that will guide you to being able to select for yourself which measures are the most important and which elements of data you need to be successful as case managers. So there was a neuroscientist named Antonio Damasio, And he had some cutting edge insights into what happens with how our brains make decisions because of some very interesting patients that he worked with. One patient he tells a story about is a gentleman named that he dubbed Elliot. And Elliot was this very successful businessman who had a brain tumor, unfortunately. The good thing was that this brain tumor was treatable by surgery. So Elliot underwent this brain surgery. They found out he had some frontal lobe damage in a special part of his brain from the tumor and from the removal. But after his recovery, they ran him through a battery of tests and everything seemed normal. He had great cognitive function, perfect recall. His memory was wonderfully intact. He seemed to have all the same cognitive skills he had prior to this surgery and brain tumor. And yet his life fell apart. He went from being very successful to making this string of bad investments. He actually fell into business with a swindler and started this semi-illegal business activity. His marriage fell apart after being happily married for years. And what was happening was he was basically unable to make any kind of dependable, rational decision as we would see them happening. So his doctors continued to work with him and try to say, what brain damage is here? What's happening? Why are you not able to make these decisions the way that we would expect? And everything came back normal. They said, we can't identify anything that's wrong. And then Damasio stepped in as a neurosurgeon specialist and said, all right, we're going to run one last series of tests. And it involved Elliot considering these different social situations, from very simple of like, what time would you meet somebody for tea, to quite complex social interaction. And at the end of one of the sessions, Damasio tells this story about how Elliot produces this abundant quantity of options for things he could take action on, different things he could do in a given situation. And he sort of smiled when he was done and he looked very pleased with himself. And then Elliot added, after giving this string of options, that he said, after all those ideas, I still wouldn't know what to do. And it struck Damasio that even though he could remember who he was before, he had no sense of value of how any of those actions might lead to outcomes that mattered more to him or less to him. Because in fact, none of those options mattered more or less. None of those outcomes meant anything to him anymore. He was no longer able to make choices that achieved a meaningful goal because all his goals basically felt the same to him. And what Damasio concluded in understanding Elliot's condition, as well as a number of other patients that he worked with, that counter to our intuitive understanding now that somehow emotion gets in the way of us being able to make these reasonable, rational decisions, that in fact, a reduction in emotion may constitute an equally important source of irrational behavior as compared to losing the cognitive rational function that we're used to. And this was a breakthrough that Damasio and a number of other neurosurgeons made in understanding that actually emotion is an integral part of the decisions that we make. Another way to sum this up is the idea that to know but not to feel, right, leads to the same inability for us to make effective decisions as just not knowing at all. And that's a fundamental change to how we oftentimes bring data and our understanding of values and emotions to making decisions. So I'd like you to imagine something simple here. Pretend that a constituent comes into your office. You know them, but not well, and they come in. How would you greet them? And just think about that for a second. Like, how would you say hello to them? And I love starting with this because it's a very micro decision that we make often, right? How do you interact with somebody that you pass on the street, that walks into your office, whatever you might do, right? But you actually have this plethora of options. You could shake hands, you could bump elbows, you could do my daughter's new thing, which is like a foot five, right? You have so many different ways that you could actually greet them. Now, if you go ahead and like on a sticky note, you could jot down the decision you make, because I want you to then look at that decision and say, how did you come to that decision? And what you did without being conscious of it is the same framework that Elliot was no longer able to do. First, you decided what's your goal in greeting them, right? What matters most to you? It could be right during COVID, our number one goal was not to get each other sick. So we all changed the ways that we greeted each other because that became the primary goal of what we wanted to do. If this person is actually somebody who walks in and looks distraught, right, you might greet them in a way where your primary goal is to make them feel better. Conversely, if it's somebody that you've seen 6 times and you are tired of them showing up in your office, you might greet them in a way that lets them know actually you're kind of busy and maybe they could like sit down and not bug you for a little bit. But you intuitively came up with what was your primary directive. Then, once you established your primary directive, you figured out what were the things that went around that. What were the values that also were at play, even if they weren't the same as your primary goal? So now that our COVID concerns have abated somewhat, right, getting sick is less forefront in our minds. It might be something we don't care as much about, but you might still care about it a little bit. So maybe you might give them a quick handshake, but you're not going to give them a hug because that's just a little bit too much like contact. Or maybe there's constraints at play. What if the person who walks into your office, looks under 18? And there's some concerns about contact with underage people, because I know with a lot of my childcare settings that there's a lot of regulations about how you interact with somebody who is underage. And so there may be constraints in addition to values that also matter to you that could influence how you choose the way that you achieve your goal. It could even be something that's just non-negotiable, like the person doesn't have a right arm. Well, you can't really shake their right hand. They don't have a right arm. So you're going to adjust how you achieve your goal because of that. Then lastly, what you're going to do is once you've figured out your goal, you've understood the values and constraints, which in your decision of how to greet somebody, you've done completely unconsciously. You're then going to use data from your past experience to decide which of those greeting options are going to achieve your goals while supporting your values and honoring your constraints. So the reason that we might not hug if we're afraid of passing germs is because we understand close contact gives us germs. It makes us sick. If we didn't have that data to know that hugging is more likely to make you sick than shaking hands and bumping elbows is less likely than shaking hands, we wouldn't be able to know which of those options is going to help us achieve our goal or stay within our value constraints. If we didn't understand the laws, right, regulating how we might contact somebody, or if we didn't have social awareness, right, a social construct, data on, hey, when I hug strangers, they freak out, so I probably shouldn't do that, right? That's data that we've gathered from our experience. Now, I start with such a simple decision, while it might seem silly to think so deeply about it, because you went through every single one of these steps as you made this decision, completely unaware of the fact that you were doing those steps. And the goal of today's presentation is to bring that framework to the forefront. We want to take these steps consciously and intentionally. And part of why I want to make this conscious and intentional is because it goes against a lot of the things we've been taught about how to make decisions, right? Economists have this concept called an econ. So when they talk about making these like rational data-based decisions, they intentionally leave emotions and values completely out of it. But that framework is flawed because they're already deciding for you what you should care about, right? Maximizing utility, making the most money, whatever it might be. But they've made that decision for you. And my goal in making this explicit is that we have to be clear that we're making the decisions of what matter to us. So I want to make sure that we are clear. We cannot make decisions without these value understandings and our goal. But when we are not aware of the goals and the values that we're bringing to bear on our decisions, we then do them unconsciously, and we may adopt other people's goals, or we may adopt the goals of the system in power, or we may adopt the goals of what we've always done without examining whether those are actually what we want to do. So Elliot couldn't make a decision, right? Because nothing mattered anything more than anything else. Not having values at all creates this flat decision-making landscape where nothing can be distinguished from anything else, right? Imagine in your casework, if it didn't matter whether somebody was able to get their benefits or not, right? Those outcomes were equally valued to you. How would you decide what your next step would be in helping them close that case? You really couldn't, because you didn't know what you were trying to achieve. There wasn't something that mattered more than something else. And I refer to this as the Cheshire Cat syndrome, right? When Alice gets lost, she turns to the Cheshire Cat and she says, "Which way should I go?" And Cheshire Cat says, "Well, where are you trying to get to?" And Alice says, "I'm not really sure." And the cat responds, well, then it doesn't much matter which way you go anyway, does it? And that's where we get stuck when we're not clear about what our goals are and what we're trying to do. We bring our values to bear here because they're what give us the differential weight to options. They're what make one option matter more to us or be different, that will make it different from other options. It makes that differential there. And we cannot make decisions without those values. At the same time, it's important to remember we're also lost without data. These are two wings of the same bird. If you only have one of them, you are flying in circles. So you need both the values and the data. And here's what I want to charge you with. How do you know you're achieving those goals that we set when we're clear about our values? How do you know if you are staying within your constraints? And how do you effectively evaluate the options that you have in front of you against achieving those goals if you don't have data on hand to tell you which options may be the most effective? And once you choose them, whether they're actually going to be, whether you're actually achieving what you're trying to do. I'm assuming that folks on the call use Google Maps or Apple Maps or Waze or whatever it is. And this is the perfect example of how this framework actually functions. Because when you pull your phone out, right, you're like, it doesn't just automatically give you a map. I do have Apple now suggesting like, hey, are you trying to get to school? Because it's 3 p.m. But the funny thing is it's taking a guess based on past patterns. It doesn't really know where you want to go. And in order for the map to be useful, you have to have a destination, right? A place you are trying to get to, right? Then once you have this destination, you're able to plug it in, right? Like, yes, in fact, I am going to pick up my daughter at school. Please tell me how to get there. But then the interesting thing that Google does is that it doesn't just give you one route. It gives you several routes because it actually doesn't know what's going to matter most to you in getting to school. So it didn't know where you wanted to go, might have taken a guess, but it still needs you to tell it, yes, this is where I want to go. Then it's going to say, well, do you want to get there the fastest? Do you want to get there in the most eco-friendly manner? Do you care about spending money on tolls? Or my favorite that Apple will do is this route has the fewest turns, right? Do you need the simplest route to get there? Here's the thing. Google has the most data that any organization has ever had in the history of mankind, but it cannot tell you which route you should pick because it doesn't know whether being there on time or being there in an eco-friendly manner or avoiding tolls or simplifying the route is what matters most to you. Only you are able to say, you know what, shoot, I'm supposed to like surprise my daughter at school. And if I'm late, she's going to hate me forever, right? That matters most to me right now. So I need to get there as fast as possible. You have that value judgment of making the driving factor behind your selection of your options based on those values. Now, what makes this so effective is that once you've decided I need to get there as fast as possible, Google or Apple have all the data to tell you, well, this route will most likely get you there fastest. Because without all that data, your desire to get there as fast as possible doesn't help you pick an option because you wouldn't know which option is going to get you there fast. So having all that data then allows you to evaluate your options against the value that you are trying to uphold and the constraints that you may have in place. Now, those first 3 steps we do every time we make a decision, whether or not we are aware of it. The last step that makes Google so darn good at what it does is because it also learns from the mistakes it made and it learns from the things that go well. So I'm going to add one last step for us as we work through this framework about evaluating what we do and continuing to improve the way that we make decisions with this framework. And that is what's made Google especially so good at helping you find your way. And I don't know if you've seen that sometimes you'll get there and it'll be like, hey, how was this navigation? And you can give it a thumbs up or a thumbs down. So we need to do that same thing in how we do it. Now, when I came up with this framework, I was like, this is value-based decision-making with data, and that is not a sexy name, and no one will ever remember that. So I came up with a cute little acronym that hopefully will help us walk through this framework, which I called emote because it seemed appropriate for our use of emotions in making decisions. So the way this framework works is that you start with an Eden, right? Where are we trying to get to? What matters most to us as we go along this journey? I'm a geek, so I will bring up the fact that, as Star Trek says, what's your prime directive, right? What are you trying to do? It doesn't matter how small the decision is, there's going to be something that you want most of all. And so right off the bat, this framework helps us because we have to explicitly state what one thing is the most important to us. Then once we're clear on, right, that Eden we're trying to get to, then we bring into play what are the morals that we're going to use to help us decide and evaluate the options that we have, or what are the constraints that we're going to need to respect and mitigate. Only once you have those first two things in place, explicitly stated, do we bring in options. It's at this point, right, that we're going to start brainstorming or looking around, finding out what are the ways that we could get to Eden. At this point, you want to make sure that you're just bringing up options, right? Cast your net as widely as possible. Again, the point of this is making this decision process explicit and out in the open. So we want to give ourselves that chance to come up with as many ideas as we really can. Only once, right, we've got our destination in place, we know the guardrails we're going to follow on it, we've brainstormed lots of different options for how we can get there, or we've asked Google for a number of different routes, right? Then we triangulate. We bring data to play to help us understand how these options might fit into our different morals, our different mitigation strategies, and ultimately how well they'll get us to Eden. We use the data in order to evaluate those decisions so we have the best chance, right? We don't always know for sure. Data is not always able to tell us, right? It does a really good job describing what happened. It's not so good at telling us what will happen because it has to take a guess. We don't know for sure, but it gets us our best chance. Then once we've made those decisions, once we have headed down that route, we want to check our watch and see, are we on schedule? Did this route actually live up to the promised time or not? Are there other considerations we didn't take into factor when we made this decision? Were there data points we left out that would have helped us better evaluate this? So evaluate is that learning piece that helps us go back and say, are we on the right track? And more than that, because of the challenges that you face as caseworkers are not necessarily simple ones to solve, oftentimes we're going to have to try something. We might not know it all. There may not be data that tells us for sure how to solve this problem. So you'll take your best guess. When you take the time to come back and evaluate, how well did I do on that guess? Then the next time you're faced with something similar, you'll be better armed to make a better decision. Or it may be a protracted case where you're going to take your best guess, come back in and triangulate, assess whether you actually are getting closer to Eden, and you may make a new decision that helps course correct or helps you know that you can stay the course and keep on trucking through to try to get to the end. All right. So again, just as a conclusion around the first step, right? We are trying to get to where we're like this perfect world, Eden. And I called it Eden because I do think it's nice to sort of dream about this perfect world, especially for those of us who work in nonprofits, who work in government. I think a lot of the times we do that because we are trying to make the world the best place that we can. And it reminds us that everything we're doing is in this service, right, of improving the world. Now, I also have to respect the fact that Eden can be a bit misleading because most of the time we're going to have to make some compromise. We're not going to actually be able to make things perfect, but it's nice to dream about that. And I think it reminds us that we're doing something that matters to us every single day. So the last part I want to really remind about Eden is that data cannot tell you what your Eden should be. Right? Data can't tell you what should matter most to you. It is completely dependent on the driving mission of your group and your organization. What is it that keeps you doing what you're trying to do? And if you're doing it, making a decision in your own life, right? No one could tell you whether you should want, if you're trying to figure out how to move. I was talking to Anne that we're moving. Like, what matters more to you? Do you want to be close to the people that you care about? Do you want to be in an environment that supports you? Do you want to be near a job that matters to you? Right? All those things are decisions you have to make for yourself. No data could tell you which of those should be more important. All right, so then our next step, right, we move on to this idea of morals and mitigation. So once you know where you're trying to get to, you then have to say, well, what are the knock-on effects, right, that might happen in the decisions that we make on our way there? We know we're trying to get there, but if we think about that eco way versus the fast way, right, there are subsequent impacts that the options will bring. And the interesting thing is I see in political discussions that happen around us is that oftentimes we think we disagree about Eden. We think, oh, this person that I don't agree with, the person across the aisle, whatever it might be, they want a different Eden than me. But often it's actually that we disagree with what we're willing to pay or what we're willing to give up or what we wouldn't be willing to give up or what we wouldn't be willing to pay in order to achieve that Eden. And I think about this in so many different contexts. One of the ones that stands out to me is looking at how we do our legal system and how we'll do convictions, right? Somebody comes to the court and they're being tried for a crime. We have to make a decision of that trade-off of would we rather run the risk of imprisoning someone who's innocent or letting someone go who is guilty and may commit a dangerous crime again? No data could tell us which of those would matter more. And I think we could all agree, we all want to live somewhere where we don't have people in our midst who are trying to hurt us. But some of us are more willing to run the risk that an innocent person gets imprisoned to increase public safety, while other of us are not willing to do that and would be much more willing to have somebody set free who shouldn't maybe have been, or that have somebody released that could additionally do another crime, because we would want to protect the justice and the innocence of people who shouldn't have been in prison. So we actually both want the same thing. We just disagree about how to get there. And that's why being clear about our morals and what we're willing to do and not willing to do is so important before we get into the argument about, well, did you know we imprisoned X number of people who shouldn't have been imprisoned? And then when the other person's unconvinced by that fact, you think that they just don't want to, they don't care about justice. But in fact, they care more about safety than you do, or the other vice versa. The other person cares more about justice versus safety, right? That the idea of what we're trying to achieve and what we would give up or not give up is often where we disagree the most. And this is why bringing this to the forefront, right? And Anne and I were talking about, you have a case. Does it matter more that you close that case quickly, or that you get the best possible result for somebody, right? You get the most of what the person asked for. No one can tell you which one that is. That has to be a discussion within your organization, because then that leads you to evaluating decisions and the options that you have based on, do we track the time to closure? Do we track like the amount of money we were able to get somebody in conclusion of their case? Those are all things you have to consider. So then once you are clear about the morals and the mitigations that may have to come into fact, now you bring up your option. What are all the different ways that could get you to Eden, right? What are all those possible things? Then you need to bring up this idea of how well will each option get us there. So if we're very clear that our primary objective is to close satisfactorily as many cases as possible, right? We could look at all these different options and we'd have to understand, well, how well do these different options help us close cases? Because you may find that some options don't contribute at all to closing cases, so you're going to get rid of those. And then some options may be much better than others in closing cases, so you're going to lean more towards those ones that might help you. But, right, we're going to refine that as we move along through the process. So no matter who you are, no matter what organization you're working for, no matter what the case looks like, the first data point that you need in making effective decisions would be, how close does each option get us to that goal that we defined earlier? But again, I can't tell you what that data point is because it's going to be driven by what your goal is. So you can define your goal, and then that will directly lead you to the first data point, which is, well, how well does that option get us there? You may know for sure, or you may have some data that helps you guess. Or you may have to experiment. Say, I have no idea which of these options will get us there. So let's try 3 of them. We'll track the data for a week and we'll see which one was more effective. But that's the first data point that everyone needs. Then once we have that idea of those options, right, and how in data point 1, they're going to help us get to Eden, we need to understand in that triangulation, right, are we violating any of the restraints that we know or constraints that we need to mitigate? Or are we violating any of the values that we know we care about? So the first and usually the most easy to evaluate is that data point of, are we fundamentally exceeding resource constraints, right? So data point number 2 is, how many resources are these options going to take? Because if they fundamentally take more time, more people, more money, tech that we don't have, whatever it might be, then we know that we can't try them right now. So we can get rid of those options that fundamentally violate resource constraints. But the second part of that triangulation is a lot harder, right? Which is, how do these options play with the values that we care about? And what's hard about this, and this is why we oftentimes will implicitly make these decisions rather than explicitly, is that sometimes we have values that are in conflict with each other, right? A value for our primary goal may sometimes conflict with a secondary value that we have, right? Where you really want to achieve one thing, but in order to maximize your achievement for that one thing, it may require a violation of another value that you hold. And so we need to be really clear what we're going to do if we hit those points of trade-off. Or we may decide, right, that when we look at our options, that we would be more willing to give up a little bit of the primary goal value in order to uphold more values, right? That I could do an action that would not only close more cases, but would make sure that there would be more equitable distribution of those cases. That would be a perfect world. But what happens if there's one option that's going to maximize the number of cases that you close, but you might close more cases for like more privileged people at the expense of closing cases that are harder for a less privileged, less represented population? What do you do in that case? Again, no data could help you make that weight decision. What the data helps you do is understand that one option may be less equitably distributed than the other. And that's why we need both the data and the values. So then we talk about that there's going to be data points, probably multiple data points, of the impact on our core values, right? That we need to understand not just, are we supporting our primary goal? Are we staying within our constraints? But how do these choices also impact our values and the things that matter to us and to our organization? And this is different than how we typically make decisions. So I want to just pause and acknowledge that this is not our typical decision-making platform. What we often do is this one, right? This is one we're real comfortable with, which is cost-benefit analysis. And this is how we're taught to make decisions, right? We're taught, we'll gather data about how one thing will benefit you, gather data about how one thing won't benefit you, and you weigh them. Pros and cons list, right? I vividly remember junior year of high school, and my best friend in high school was trying to decide what college to go to. And she'd made this long list of the pros and cons of her 2 top choices. And it was so detailed. And it was funny watching her like ultimately make the decision, because that was one of the first points that I realized what was missing from that list of pros and cons. It's like, what do you want most? Yes, this one's more prestigious in research, and the other one, had better college life. So how do I use that to help me make any kind of decision? So instead of this teeter-totter of a cost and benefit analysis, right, instead we can triangulate. And this is why I picked triangulate, which is there's actually 3 core data points that have to come together. Because the only thing, if we go back to Elliott, that can help us understand how much the benefits and costs pull on that teeter-totter is by the weight of their values, right? There's no way of even understanding which way the teeter-totter goes up and down if you don't understand the weight of the thing on either end of that. So when we think about this example again, it works when we're talking about equivalent units that we inherently understand the value of, right? We're going to invest $30,000 into a new CRM because that's going to save us $50,000 of paying this external company to manage our current crappy one. That's a really easy cost benefit analysis because both sides of the equation are in dollars. They have equal weight, and we can pick the one, right, that would result in the cost saving. At least that's typically how we would make that decision. Now, I would argue that there may be things we didn't consider that are not necessarily in dollars. Again, what happens if, like, yes, we'll save $20,000, yay, but we're going to double the workload on our interns? Well, how much do you care about the well-being of your interns, right? Like that has to come in to the play in the choice that you make. And it may be a value. It may be something where we say, no, we don't want to burn out our interns. We want them to stay with us and work with us long term. Even if it's going to cost us more money, that investment in the people that we care about matters more to us. And that's where then you have to have this triangulation. There is a funny story that helped me really understand this, because that made it really clear to me about how those values are just implicit in how we understand things. As Anne mentioned, I went to grad school in England, and so I was very American in a very not American place. And this movie came out while I was there. So I don't know if you remember this like very old school movie, right? So Live Free or Die Hard. And the title, of course, comes from that revolutionary sentiment, right, of give me liberty or give me death. And this movie came out while I was in the UK. And the funny thing is that they did not call it Live Free or Die Hard when it came out. They called it Die Hard 4.0. And I laughed like when we showed up at the movie theater to go see it. And I was like, that's not what this is called. Like, why did they change the name of this? And my British friend that I was going to see it with sort of looks at me and she's like, they changed the name? Like, what did it used to be? And so I said, it's called Live Free or Die Hard. And she just like had this very funny expression on her face. And I realized that she had no context for why that name would make any sense. So I explained to her about, our revolutionary forefathers like planting that virtual flag and just saying, hey, like we would rather die than live under this perceived tyranny. She looks shocked and she goes, well, that seems incredibly harsh. And I realized like at that moment, like English culture really doesn't place any value on liberty. They're quite happy to give up liberty and freedoms for fairly small benefits. So for example, there's no such thing as free speech in England. You can be arrested for saying something that offends somebody else because they would rather lose the liberty to say things in exchange for having this very civil discourse and a protected society where you don't have to hear things that offend you. And it was just that reminder of like the worlds that we lived in had these very different base operating assumptions about what mattered more. And it had nothing to do with what was right or wrong, right? We just came from different backgrounds, different histories, different cultures about what values would be more important than others. And the interesting thing is, I don't think we're very good at having these conversations. It was funny to have it in the context of Bruce Willis's latest movie where he fights terrorists or whatever it was. But there's actually some really hard conversations that we have to have about this that are incredibly uncomfortable because it ends up bringing us into this conversation where we have to decide which would we rather have. And it seems weird to have this conversation around what data metrics should we have when we're tracking casework. But actually, you can't use data to help you do casework better if you're not willing to be able to have these hard conversations about what matters to us more, right? What actually is what we're trying to achieve. When we say we want to make sure that we're satisfactorily closing cases, what does satisfactorily even mean? Is it what you think is a successful close? Is it what the constituent thinks is a successful close? Is it what your boss thinks is a successful close? How are you defining that success? And what happens if you can only achieve that success at the expense of other things that matter to you? And that's the worst part of these conversations, right? It's just, again, if we go back to the equity example, right? What happens if a solution will work better for one group than another? Will you do that? And so I think that what we have to remember, right, is that by explicitly defining those values and giving us that hierarchy of which things matter more to us or which things are non-viable, right? Like we won't violate that, even if it gets us where we want to go. Then you bring data in, and only then do you bring data in to help you understand, right, this triangulation. So if we go back here to our triangle, right? You're gonna need data to tell you what the costs are. You're gonna need data to tell us what the benefits are. So we talked about that data point number one is how well will it get you towards your Eden, right? Then you have to look at secondary benefits, right? Will this option get me towards Eden, but also promote equity, or also promote longevity of our staff, or also promote the fact that we're like more likely to get our team voted for, right? Like whatever it might be, there might be secondary goals that you have, and you need to understand the benefits, not just for Eden, but for those secondary benefits. On the other side, you need to understand the cost, not just in terms of resources, though that's essential because there's certain constraints you just can't get around. So you need data to understand the costs, but you also need data to understand the costs to values that you care about, right? So are we willing to maximize the progress towards Eden at this cost to these secondary values? And the only way that you can then evaluate that teeter-totter, as we talked about, is to give those weights. And that's where you have to have those discussions, which matters more, because that's what will weigh whether you're willing to pay $10,000 to improve retention of staff, right? Or you're willing to pay $20,000 more in an intervention in order to have more equitable distribution of case closure. I mean, how much money is equitable distribution of case closure worth, right? Like that's not something that data could tell you. What data could tell you is that it'll cost $20,000 and that the distribution of case closure will look like this, or did look like this when you did that intervention. I want to be respectful of time. And do you want me to end right at well, it's 9:45 for me, 11:45 for you guys.
No, if you have a couple more slides to go through, please go ahead
Okay.
and wrap up. This is so useful.
The last thing that I want to be explicit about, because I understand how uncomfortable these conversations are. Anne mentioned I come from a public health background. And we had a very interesting discussion at a conference, a scholar conference I attended, about the idea of how we distribute the about $55 billion that go to global public aid for addressing things from malaria and rotavirus, vaccinations, personal safety, all those things that happen around the world. And we had a speaker who challenged us, which said, would you rather save 100 children or 100 people over the age of 70? And we all sort of like, I'm sorry, you can't ask that question. He's like, well, I'm asking it because we're making those decisions already. We only have $55 billion that gets spent every year on these global public health issues. And when we choose to fund a rotavirus vaccine program, right, we're not funding an Alzheimer's research project. So we're making that decision. We've just made it unconsciously because we're too uncomfortable to talk about that. And I remember just being floored and like slightly sick to my stomach going, I have to think about that. But what came clear in what he said is that when we don't talk about those things, it leaves them in the dark. It leaves how we make those decisions opaque. And when we make decisions in the dark or behind closed doors or without really talking about the horrible things that make us want to throw up, then we tend to make those decisions implicitly. And what we've learned is that when we make decisions implicitly, they are guided by our bias. They're either guided by our own internal biases or they're guided by the biases of the systems that we work in. And if we're guided by our own internal biases or the biases of the systems we work in, then what we tend to do is reinforce the systems of power and what has always been. The UK is amazing at doing things the way that they've always been done. But sometimes we find, right, that that's not how we want to do things. And so by resisting that, like avoidance leads to the dark side of bias, and being willing to have incredibly uncomfortable discussions, right, then we're able to actually be explicit, bring data to bear on how we make these decisions. The last thing, right, that we talked about that we come back to is that evaluate step, right? So we've had incredibly uncomfortable conversations. We've made some decisions about which we would rather have. We've brought data into helping us understand, do those options help us get to the Eden in support of the values that matter? And you've only picked the data points, right, in service of those things. And what's nice about this is then you can not worry as much about those other data points, right? By being real clear about what you're trying to achieve and what you want to support and what costs you're not willing to pay, you'll now know the data points you need to track, and you can let go of some of those data points that don't fit into that framework. But the last thing that you really want to make sure you are tracking is, did the decision we made get us closer to where we were trying to go while honoring the constraints and values that we wanted to honor? And if you don't track that data, if you don't track, did we do what we said we would do, there's no way for you to learn and get better. And there's no way for you to hold yourself accountable. There's no way for you to know when you stand up and said, yes, we are doing the best we can. Are you? And only data can answer that. So only values can help you know what should matter to you and where you should want to go. But only data can tell you if you actually achieved where you were trying to get to. So that, right, is the summary of the framework. We have Eden and the values and the mitigation things that we need to be able to uphold. Values only. When we select our options and we're triangulating, it's bringing them together because we use the values to give weight to the data, right? How much is closing a case worth to us in dollars or hours? I need values to be able to translate those different units into something similar. And then when we get to evaluate, at that point, it's all data, right? It's really just telling you, did you do the things that you said you were going to do the way that you said you were going to do? So I have a few resources if they are helpful for you. I have slides for this presentation available here on this, and Anne will also share the recording, as well as I can turn all of these into PDFs. You may be able to tell that I get slightly excited about talking about these things, that I love this. It's near and dear to my heart, and this is my Eden for me. So if there's any way that I can support you in your journey in trying to identify these data metrics, figure out how to get what I hear are not always the most helpful CRMs to actually behave themselves, please feel free to reach out to me. I have my email address there, and Anne can also connect you to me. So I would love to hear more as well about the challenges that you face with data and in figuring out how to pick the data that would be most helpful for you. So I'll stop there, Anne. We've got a little bit of time for some questions. And yeah, I don't know if people can do like chat or Q&A. Like, I'd love to hear people have questions, what they thought, all of it.
Absolutely. First of all, enormous virtual round of applause for Alexandra. Thank you so much. I know I'm probably not alone, just frantically scribbling notes about like, this is so relevant for cases. This is so much of what I wish I had when I was running a casework team. So thank you again for sharing your insight. And to follow up on your point about just additional resources, I do just want to flag for folks, Alexandra has very kindly offered to come back for another appearance for our professional development subscribers. So if you're interested, we will take time in May 11th for subscribers and do a 90-minute deep dive that'll be more interactive, where Alexandra will walk some caseworkers who join us through some worksheets and some kind of exercises to figure out how can you translate that emote framework into the data that your office is working with, into the values that your team has already expressed. So again, that's popbox.org/casework to learn a little bit more about that and get signed up. And I'm very happy to answer any questions. And let me just drop this link again one more time for folks who joined us a little bit later. As Alexandra teed up at the end there, we know that the data that your team can gather is a little bit dependent on which CRM you're using, and you may have CRM specific questions. So the CRMs did provide us with some information about their analytics capacities. So feel free to take a look through that link just to see if you have specific questions about what you can and can't do with your CRM. And we do have a few minutes for questions, so please go ahead and drop those in the Q&A, but I certainly have one to kick us off. I'm going to take host prerogative here.
Sure.
There are a couple of big metrics that most casework teams track. There are things like casework open versus closed rates. There are things like money returned to constituents. There are things like cases that are resolved favorably or unfavorably. A lot of those are not set based on that team's values necessarily, but based on a kind of competitive pressure. Every other office is looking at these metrics, so we have to also look at these metrics and put them on our website, and the way that we might measure those metrics is going to change based on how other offices around us are measuring those metrics. Do you have advice for offices and maybe kind of having a conversation with leadership about how to approach those metrics? Is there a way that can be kind of more true to the intervention that the casework team is actually doing for those constituents?
Yeah, so nonprofits face something similar with the idea of like, you want to prove that the things you do are effective, right? That I'm having an impact because I want to be able to show to funders, right? That they should fund me because I have this impact. And so there's then a pressure to evaluate your programs in such a way that it shows a huge amount of impact versus a clear understanding of what are your programs actually doing, which may not be the most comfortable thing to look at. Especially in light of the idea that maybe it's helping you in one way, but violating something that matters to your organization in another way. And so the first thing I think, and this is why I really like this framework of values plus data, is rather than getting into, which is what I would do normally because I'm so technical, an argument about the best way to calculate something. And I would pull out all the data stops of, well, we have to consider like this restriction on using this method. And when we calculate it this way, we're leaving this out of the denominator. That's not where you would start. You would start with what are the values that we are trying to uphold. And it's okay if one of the values is making us look better than the other groups, or at least as good as, right? Like that we need to look as good as these other groups. And what you may decide, for example, and this is where being creative with your option is, maybe we have a set of internal metrics and we have a set of external metrics. And we make sure that the external metrics are in line with how everyone else is calculating them so that they are comparable. But for our internal metrics, because there are things that matter to us that may not matter to those other groups, we want to calculate these things either slightly differently or add a contextual measure that helps us kind of check when we say a case closed. Well, maybe we define it the way that everyone else does for the external metrics. But for us, we're not going to consider a case closed until blank happens, which may take longer. And that's okay. This is the whole point again of like, there's not this explicitly right way of doing it that just exists in a book you can download from the cloud, right? Moses coming down from on high with the tablets of like, here's how to calculate casework metrics. And so having those thoughts about maybe we have several sets of metrics. And there are organizations that aren't casework organizations that will have that even within their own departments, right? Sales department's going to calculate turnover this way. Marketing is going to calculate turnover this way, and product is going to calculate turnover this way, because they each are focusing on different parts of that equation and different things matter to them based on how they can intervene, right? Marketing can't do anything about bugs in the product. Products can, but they can't do anything about how people are, reached out to and how sales manages it. So they may focus on different elements. And I think it's perfectly okay if you have the explicit discussion to say, here's why we're going to pick different measures.
That's so helpful. And again, yeah, just to double click, like having the discussion with leadership on so many different aspects of casework, the resources that your team needs. Do you have enough people? Do you have enough equipment? So much more helpful if you have data to back up. Hey, yes. I don't just want 3 new iPads. I need 3 new iPads so that we can do office hours in 3 new towns to make sure that whatever metric we're measuring.
Well, and imagine that your case of, I need 3 more iPads because we don't have enough time anyway, versus the conversation of, I need 3 new iPads because we just had a discussion about how we want to make sure we close cases within a week. And I can show you that missing these 3 iPads is leading to us having a 4-day delay on case closure rates, right? Because you've just brought up, here's the thing we agreed mattered the most, close them within a week. And I have data to show you that the current way we're doing it isn't getting us there. And so being explicit that we've already decided, right, this is where we're trying to get to, and we're on the same page trying to get there. Because that also sometimes brings up when you have debates, especially with leadership, where there's actually a difference in where you're trying to go, or a difference in the value, again, more likely, of what you're willing to pay to get there, right? Like it may matter a lot more to you to not be overworked, but your boss cares a lot less about that, right? Like, which is not a great situation. That just came into my mind. But like that idea of like understanding the values of that in the discussions that you're having. I do see a question that just popped in. Are there better ways to identify metrics that show larger trends or systemic issues that don't just show a snapshot? So I love this question because trends are critical in understanding when we talk about, are you getting closer to your goal? Well, it's hard to know if you're getting closer to your goal if you don't know the story of the whole journey, right? And also because many of our journeys are a step forward and a step back, right? And so we want to understand that over time. And you can probably answer in terms of a little bit about the fact that like CRMs don't do this well. What I would say as well, and this might be a little bit hard, is that sometimes built-in systems don't do things the way that we want. And so if you identify a metric that you're like, I really need this metric, rather than fighting with your system and trying to get it to do it, there may be value in trying to pull a few data points from different places and tracking them yourself. Even if it's a simple Excel sheet where you just say, every morning I'm going to go in and I'm going to download this one data point. And now I'm going to build this trend that I will have daily data for this over 6 months. And that's going to help me see it. Like, we do sometimes have to think about the fact of getting a little bit creative outside of our systems, but I also am aware of that concern that just adds burden onto you, right? So like, you don't necessarily have the time to be able to do that. And so you have to have kind of this trade-off talk of like, I really need this data point. My system doesn't do it. How do I handle that? So I'd be curious, Anne, what you think about that.
Yeah, absolutely. And I will say, again, I can speak from my experience with this one office using one particular CRM, but we actually did work with our CRM to find a way that we could download and export our entire data file for every case that we'd ever done. And then we built our own kind of analytics dashboard using Google Sheets. So there are ways to do it. Again, it was a huge amount of work. It was super fiddly. Every time the CRM changed the way the export came out, we had to redo the whole spreadsheet, but like it is possible. But actually that tees up perfectly for something I did want to ask about working with CRMs. And I know you have a ton of experience working on data visualization tools. All three of the big CRMs do advertise, especially when they're talking to new offices, that they are flexible, that they're willing to work with offices to develop new features depending on what offices need. And it can be really tough to kind of have a productive conversation if you're not familiar with more than one CRM to say, I want a feature that does this. Do you have advice for kind of working with the tech side to just ask for what would be helpful?
That's a good thing. It comes back to saying, what's the ultimate goal, right? Like, what do you need the data to do? And so as Ashley asked about tracking trends, I think what helps is, instead of saying, so I want you to change this button and I need this download to look this way, that you say, what I'm trying to do is be able to compare our open and close rate over at least 6 months. And then leave it up to them to figure out how that happens, right? Because you're exactly right that if you don't have a huge familiarity with how the different CRMs might work or how that might function, it can feel very overwhelming of like, I don't even know what to ask them to change because I don't know how it's working. But I think it's perfectly appropriate to go to them and say, I need this outcome. I need to be able to have data that answers this question. Can you make that happen? And then you may have to work with them because they may offer a solution that then you'll have to kind of test either in your mind or actually if they put it in place and say, did it get you there? But I think focusing more on like, what is it that you're trying to solve? What's the thing that you need? Because I've also seen when you have like this flexibility that you kind of go down these rabbit holes of like, change this, change this, change this, change this, but you sort of forgot what you were trying to get to ultimately. Like what those questions were that you needed to answer, or what the view was that you needed to answer. And so by always kind of keeping that higher level view of like, here's actually how we're going to use the data, it can keep you. And I mean, this decision-making framework we talked about works here too, which is, what's the ultimate goal? What are the things we really need? But then what are all the values as well, right? Not only do I need to be able to trend, but I need you to be able to do it in a way that takes me less than 5 minutes, because my time is booked up in so many other places that time element is just as important, right, as a value and constraint as ultimately being able to trend this stuff over time.
That is so helpful, and keeps coming back to a theme that we've repeated for a few of these webinars, which is casework doesn't have to be the way it always is. And so kind of keeping an eye on the future on what do you need to be able to serve constituents, and being able to ask for it, advocate for yourself and your team within your office, within Congress in general, is just absolutely going to be crucial.
And I would add real quick, I'm sorry, I know we're at time, just that the idea is like, there are people like me out there who can help you with data visualization. So if you're like, this darn CRM doesn't do what I need, I don't necessarily have the skills or the time to do what Anne's team did, there are people out there who can help. And so don't be afraid to reach out and find somebody who can help you build that external visualization if your CRM is just not willing to play ball.
Absolutely. And we were so lucky to have, Alexandra, your expertise today to help us think through some of these things.
Yeah.
Folks, we are at time. So I just want to say once again, thank you so much to Alexandra for joining us. If you are interested in more, again, please don't hesitate to reach out if you have any questions about signing up for our professional development program, for our deep dive on data, and lots of other topics coming up soon. As always, you can reach out to us with any questions, suggestions, things you want to hear more about, casework at popvox.org and at popvox.org, and we will be delighted to chat with you. So thank you all again for joining us, and have a great rest of your day.